Hello, hello.
Hi, good afternoon. My name is David Lopez from CMC.
I'm Elizabeth Ennis. I'm a physician assistant, and today we're going to go over donning and doffing of proper protective equipment.
Okay, so we'll start off. The first thing that we need to do is make sure that you wear the proper gear. The second is to make sure that there is proper hand sanitation with regards to the use of hand sanitizers, alcohol-based. Okay, before we start the process, we want to make sure the hand sanitizing happens. So Elizabeth will do hand sanitizing. Then the next step that I want to make sure is every jewelry, any watches, anything, the hair needs to be put up. So she'll do that. Hi, Vanessa.
Hi. We're videoing.
Okay, so put up your hair. So make sure when you don this, make sure that you have all the proper gear. Now, I would advise when you're wearing PPEs, I would want you to wear clothing that are breathable, not that you'll be, if you don't do that, you'll have a lot of sweat because sometimes the gowns vary and you will sweat it out. So wear comfortable clothing underneath the PPEs. Okay. She's done her hand sanitation. Make sure number one, that's the number one major thing that we need to do is make sure that there is proper hand sanitation. The next step that we're going to work on is checking your PPE requirements. So first you will have your gown. Fluid resistant gown is preferable. Number two is you have your face shield. Number three is you have your N95. Now, when you're dealing with aerosol treatments or COVID, you need to make sure you wear the proper N95. When I talk about N95, is the proper fit of the mask. Now, N95 comes in different shapes and colors. Now, you need to make sure whatever N95 you get is to make sure that you have the proper seal. You see, when I talk, it breathes, it filters the air. That's what you want. You want to make sure that it fits your face properly. Now, for some people, there will be mustaches growing. I'm sorry, but you need to make sure safety is number one. Try to trim that beard down to the point where you can fit the mask properly. Because if not, you'll have not a good seal, and then you'll risk yourself dealing with problems with COVID. Okay? The next is you'll need some hair nets, shoe covers, and your gloves. Now, in this process, we'll talk about the step-by-step on how to apply, how to put on your PPEs and how to take off the PPEs, aka donning and doffing of PPEs. Okay. First step after hand sanitation, make sure all the hair, all the jewelries are gone. Wear proper clothing. Next, put your gown. So Elizabeth is checking her gowns for rips and tears to make sure that it is a very good gown, to make sure that there's no leaks going through. Applies her gown. And then we make sure that we seal from the back so it's tied up.
We should all be able to do this ourselves. With, if we have additional staff, they can double check.
They can double check, right. Now when she's tightened up her gown, she needs to make sure that she's moving around, making sure that she has good range of motion.
Oh, so I don't tear it.
Yes. Okay. The next step that she needs to put on is her N95 mask. Sanitize again, and sanitize every step of the way. Now you'll see through the video that we will be doing a lot of hand sanitizing because of the fact that if when you touch surfaces as you go and test patients, you need to ensure that you have alcohol-based hand sanitizers. every time. So here now she's putting in her N95 mask, making sure that the fit fits her properly. Putting on an N95 is one up, one down from here to here.
So it goes, one goes up and one goes down.
So you see my ear? One down, one up. Make sure it properly fits you. This is where it's most important. You need to make sure you're fit checking your N95. You see how it formulates? Hers are a little different than mine, but they're all the same N95s. The most important part is you're fitting it to your face and it seals it. Okay?
You're gonna feel the air come in and out when you breathe.
Yes.
Okay.
Next that you will do is to put the hair nets.
Okay. Hair is a vector of transmission for infectious disease,
Yes.
especially ones that are suspended in the air. It can land on your hair and it can transmit to other places.
The next that she wants to put on has options. Now you can put the shoe covers on, so make sure everything's done.
Okay.
As you notice, every step she does, she always sanitizes. Okay, she's got the shoe covers, then sanitize again.
Yes, because I just touched my shoes.
Okay, make sure it's all dry. Then the next two steps is to make sure that we put the face shield on.
This has an elastic that goes around the back of your head, and the face shield covers the front. It has foam along the top, so it prevents things from going into your eyes. So this is your eye protection as well.
If you don't have face shield, goggles, face goggles would work. But we prefer the shield because it covers the entire face.
And you cover it with the hair cover so that your skin is exposed.
You see how she does when you look at the camera? See, it's beginning to seal everything. Okay, the final step, we'll put on the gloves. Now, on the gloves part, I want to make sure when you're putting the gloves on, that's the first layer. The first layer must never be peeled off in the process of working. Now, the first layer of gloves she applies underneath the gown. And then we need some tape. So let's see.
The first layer of gloves goes on under the gown. They don't have to be sterile, they just have to be clean.
So as you can see, when she's putting the gloves on, that's the glove that usually her normal size. For her size, I think it's a medium. She wears that. And she tucks underneath, she tucks in fingers this way, okay? Now some gowns doesn't have the hole. What you can do is you can tuck the gown underneath the glove. So for these purposes, let's tuck the gown underneath the glove
Okay.
because you have different options. So once you have it tucked, okay, and put the glove over it. Perfect.
Yeah, because some of them don't have that thumb hole.
Again, every equipment varies, so you need to practice before you go on site and do it. So as you can see, she's tucking in the gown inside the inner glove. Then you can put tape over the glove to make sure that the inner glove never gets out or rips or gets removed in the process.
So you don't get exposed.
No exposure whatsoever. So put tape over it, make sure that it doesn't slip off, okay? Then the next step is to put on the second pair of gloves, which is a size bigger than your normal hand or your normal size. Why do we do that? Why? Because every time when you have the second glove on and you're touching and testing patients, when you're done, use the hand sanitizers with the second glove on, then remove and peel the second glove. You still have your base layer glove to protect you, okay? So she's putting on the second pair, which will be her working glove.
This will be what will actually come in contact.
Correct. This is the glove that will touch and make contact with patients. Every other time she touches things or finishes a testing on a patient, make sure that she sanitizes the outer glove and then removes it and then sanitize again on your inner glove. Okay, that completes the process of the donning of our PPEs. As you can see, she is fully sealed, ready to go. Okay, everything, we try to make sure that everything is fitted well and there's nothing loose, especially on the N95 mask. Okay, then she goes off and she proceeds and does the testing. All right, now, when she's done and she needs to doff or take off the PPEs, there's a certain process for that. So the next step will be doffing of the PPEs. The first step that she needs to do is remove the second glove, the outer glove first, to remove it and dispose of it. Go ahead.
Sanitizer first.
Sanitize and dispose. Every time she touches anything, you sanitize. So she's sanitizing the outer glove. Then she removes it, keeps it on a ball. As you can see, she balls it in her hands and pulls that out. Then it disposes it. Then she gets another sanitizer to make sure whatever is there left, it needs to be applied to make sure that you have proper safety.
Okay.
Okay. Then the next step would be to try to remove the inner glove to take off. Uh-huh. Now, in this point, this is critical. You need to make sure every time again you touch something, you hand sanitize. Sanitize again. Then the next step is to remove the gowns. Now, the process of removing the gowns is to make sure the back is untied, pull it out, and roll it inward into a ball.
Without touching the front. 'Cause
Without
this is your
touching the
container.
front, because technically this front area and her arms have been exposed and contaminated. So you need to make sure that you need to be careful in taking it off. So take the back off. Now remove the gown inward, removing it out and rolling it into a ball. You see how she does it? Face the camera. You see how she does it? She rolls everything in.
So the only part of the gown I'm touching is the inside, not the outside.
Correct. Then she disposes. Then she sanitizes again. Then the next step is to remove the shoe covers.
And also also with those, you only touch the inside, not the outside. So you
The
stick
same process.
So you stick your finger on the inside and roll it across itself, so you're not touching the outside of the shoe cover.
Alright, then sanitize again. Then the next final few steps will be the removal of the top. Now, remember, if you are still in the testing site or in the area that you are working in, make sure that first is ventilation is very good. Second is to make sure that you are removing the sequence properly. So the next step that she's going to do is remove the face cover.
And this
The
is
face
after
shield.
I've tested. If I have no more patients to see, if I were going to go see another patient, I would leave everything on and only change the gloves.
Correct. So what the difference here is when she goes back earlier, when she had the gown, every time that she touches a patient or takes care of a patient, she sanitizes, she removes the outer glove. She puts on another secondary glove and then proceeds to the next patient. Okay? Now the final step is the removal of the face shield and the head cover.
Face shield first.
Okay?
Discard in a appropriate disposal.
So basically, all these contaminated items need to be in a red bag, biohazard bag containers, and you're disposing them.
Same thing with the hair covering. You roll it inside out, so you don't touch the outside.
Correct.
Take it off like a sock.
Correct. Now the final piece, when she has this all disposed and taken care of, is the final hand sanitize again. And then the final step, when everything is clear and the patient's away and you're in a clear area, preferably a ventilated area, these N95s can be removed. Now, remember, I'd like to keep the N95s all around because especially on a testing site, you don't know because you really can't see where this virus is.
Right.
So you need to make sure that you're wearing the N95 as much as possible, especially in the work areas. Now, the final step for this is the removal of the mask, and then this ends our video. Do you have any? If you do have questions, please reach out to us here at CMC. My name again is David Lopez, and we can answer some questions for you. Hopefully, this helps you.
One thing about removing the mask, don't touch the front, because that also is considered contaminated. So you always want to grab the straps and you start at the bottom one first. You take that one off because that leaves it in place. And then you take the other strap off. And that's how you take it off. You don't touch the mask. And discard of it appropriately. And then put your other mask on. So that way you're not breathing all over.
And then
everybody.
sanitize again.
Okay.
Okay.
Very good.
Thank you.
Thank you.
Be safe.